Hey everyone. Uh, so before I start, this is a bit similar to Doc Plus, the guy who did first. So what we're trying to do is we're applying AI to, in addition to help people understand their symptoms and what to do, we're doing that for the reports. So this is the standard blood report or medical report. Almost no one understands any word of it unless you're medically trained. And the crucial part is the majority of your diagnosis and care is based on that report. And there's a lot of nuances in the data that often go missed because doctors look at whatever is wrong with you right now instead of what could also be telling with the report. In addition, if you have 1 or 2 reports a year, it's not a problem. But if you have multiple reports, if there's a condition, then things get really complicated very quickly. What we're doing is we build this AI platform that translates all of those cryptic numbers and medical language into a visual experience with easy to understand health insights and actionable recommendations. So how does it work? You go through a simple onboarding to build your basic profile. You capture your medical report either by taking a photo, connecting any of your devices, adding results manually, and then you receive a color-coded output. Whenever there is a test result, a condition, or a health risk, you get a color code like Google traffic maps. Clear clinical reading, which is a very simple explanation of any medical term that is communicated to you. Most importantly, things that you could do based on those results. Health risk assessment for common hidden conditions and risks like hypertension, diabetes, cardiovascular disease. Relevant statistics to help put all of those health risks and results into context in a visual and communicative way, and helping you along the way with any health coaching that is necessary. And of course, sending you to the doctor whenever it's needed, and more. How does it work? This is at the heart of Medicus. It's called a medical reasoning engine. It simulates doctors' reasoning when they look at your report and ask you a few questions and try to give you the output. So we've built an engine that is based on the medical literature and on the guidelines. It doesn't take the latest research into account, so it's compatible with the accepted medical system and the medical liability system. And this guidelines is different between countries. So someone from France or someone from London or someone from Germany would get different guidelines based on the jurisdiction. We're a team of 38, 29 full-time, and the rest part-time. I'm a dentist, but I've always been working in tech for 15 years, and I've done multiple startups. And the last one is fintech. And Nadine is an amazing researcher. She led teams in genetic and immunology research. Makram, he's a great product guy, and this is our 3rd startup together. And Verena, she's a super energetic person that she led big teams, and she's helping us access the business in the European markets. The market is big, and it's ripe for change. But most importantly, there are 3 trends that I want to talk about. Trend number 1 is the explosion of data in the hospital system that only doctors can read and understand. And there is an even bigger explosion of fitness and wearable data that most people don't know what to do with this data, and this data is never taken into account in the hospital setting. So if you go for any issue, you get a test done, but no one looks at what your wearable says about yourself, about your heart rate, about a lot of data that your body generates on a regular basis. In addition, there's a bigger and a wider and accelerating adoption of digital healthcare tools in the population, which means that there is a potential to build something that is used by the population and enables turning this data into smart insights that is generated in real time and is integrated both in your fitness aspect and in the healthcare system. The business model is a combination of a freemium approach. It's not out yet. It's going to launch in around September, and a B2B model, which allows the healthcare providers, the insurance, to provide a Medicus augmented service to their patients, members, and customers. We've raised 600,000 last year, and we graduated from one of the best academic incubators in Europe, and we won a few awards. Most importantly, we started actively the business development pipeline in March, and we have 7 upcoming proof of concept projects that would roll out starting July on till end of the year. And we have established a small but effective market presence in Austria, Germany, France, Switzerland, and the Middle East. We're launching officially. Now you could download the app on from the iPhone App Store, but officially we're launching mid-July with the German version and announcing a few key partnerships. And we started raising our next round. We have 300,000 committed, and we're working on getting the rest. I'm going to tell you a bit about the pipeline. As you can see, I mean, today we're at 150 tests. We have the prevention working as AI. We're going out with the heart rate analysis. And we're going towards 1,000 tests towards the end of this year. We're doing sleep coaching and stress coaching based on having wearables or accumulating data. We're going into the genetic markers towards next year, and we're going to focus on certain condition management in terms of the understanding the medications, biomarkers, and coaching. And we're going towards, later on, the cancer markers and diagnostic AI, ending up with the, hopefully, the primary care AI. Thank you.